ये भी आ रहा है ना?
हम्म।
हाँ, ठीक है, वेरी गुड।
ये कल मैंने एक और लिखा ही है विषय, लेकिन
Number 1. Patient position. Supine or slightly left lateral if possible. This brings the heart closer to the chest wall and improves image quality. Number 2. Probe selection. Phased array probe, also known as cardiac probe. Number 3. Probe position. Place probe on the left third or fourth intercostal space, next to the left sternal border, with the probe marker toward the patient's right shoulder or 10 o'clock direction. Aim the marker in line with the right clavicle. What you should see. A good parasternal long axis view will show from near field to far field. Right ventricular outflow tract on top of the screen. 2. Interventricular septum. 3. Left ventricle. 4. Mitral valve, anterior and posterior leaflets. 5. Left atrium. 6. Aortic root plus aortic valve. 7. Descending thoracic aorta. What you assess in parasternal long axis view. A. LV systolic function. Look at LV size, wall contractility, mitral valve opening, septal motion. B. RV size. If RVOT is large, suspect RV pressure overload. C. Pericardial effusion. Appears as an anechoic stripe around heart, best seen at posterior LV. D. Aortic root. Dilatation greater than 4 centimeters in adults suggests pathology. E. Mitral valve pathology. Pore opening may mean mitral stenosis or regurgitation.